In our interconnected world, the health of one community affects us all. MPOX, formerly known as monkeypox, is a viral illness from the same family as smallpox. First identified in humans in 1970, MPOX has periodically resurfaced, reminding us of the risks at the intersection of humans and animals. It's a zoonotic virus, jumping from animals, likely small mammals, to people. For decades, MPOX was mostly limited to Central and West Africa, but the 2022 global outbreak changed that, showing how quickly it can spread. As of June 2025, MPOX remains a public health emergency, requiring vigilance and preparedness. The virus spreads mainly through close, direct contact, making awareness and prevention crucial. By understanding how MPOX spreads and its symptoms, we can turn knowledge into effective action to protect our communities. MPOX isn't just one virus, it has two main types, Clade 1 and Clade 2. Clade 1, found in Central Africa, is more severe and has a higher fatality rate, causing ongoing outbreaks and straining local health systems. Clade 2, responsible for the 2022 to 2023 global outbreak, is less deadly but spreads more easily, especially through close and sexual contact. The rapid global spread of Clade 2 showed how even a milder virus can challenge public health worldwide. Today, Clade 2 circulates at low levels globally, while Clade 1 is causing a major crisis in the Democratic Republic of the Congo, with tens of thousands of cases and many deaths. The existence of these two clades highlights how viruses evolve and why we must monitor both closely. Travel-related cases of Clade 1 have appeared outside Africa, warning us of its potential to spread further. Early detection and swift response are essential to prevent new outbreaks. MPOX is now a global concern, with over 46,000 cases reported in 93 countries since early 2024. The most severe outbreak is in Central and Eastern Africa, with more than 32,000 cases of Clade 1. MPOX spreads mainly through close, skin-to-skin contact, including sexual activity, but can also be transmitted by respiratory droplets or contaminated materials. While anyone can get MPOX, certain groups, like gay, bisexual, and other men who have sex with men, were more affected during the Clade 2 outbreak, while Clade 1 in Africa impacts a broader demographic, including children. Stigma and discrimination hinder our response. Everyone deserves access to care and information. The spread of Clade 1 beyond Africa is a serious threat, with travel-related cases now seen worldwide. Outbreaks anywhere can quickly become global problems. Supporting control efforts in the hardest-hit regions is vital for everyone's safety. Global health security depends on solidarity and swift action. Awareness is our first defense against MPOX. The illness is marked by a distinctive rash that starts as flat spots, becomes blisters, then scabs over, often appearing on the face, hands, feet, or genitals. Early symptoms include fever, chills, exhaustion, and swollen lymph nodes, key signs that set MPOX apart from other rashes. Headaches, muscle aches, and back pain are also common. To prevent spread, avoid close contact with anyone who has a suspicious rash, and practice good hand hygiene. Vaccines are available and recommended for those at higher risk, including healthcare workers and people with multiple sexual partners. If you suspect you have MPOX, isolate immediately and contact a healthcare provider for testing and care. Cover lesions, wear a mask around others, and disinfect surfaces to protect those around you. Following these steps is an act of community care that helps contain the virus. No country can tackle MPOX alone. Global cooperation is essential. Organizations like WHO and CDC are leading efforts to track the virus, expand testing, and train healthcare workers, especially in Africa. Vaccination campaigns target those most at risk, aiming to build community immunity and slow the spread. Improving clinical care ensures better outcomes for patients. Combating stigma and misinformation is just as important as medical interventions. Public health campaigns focus on sharing clear, factual information and building trust. The renewed joint strategy from Africa CDC and WHO in April 2025 shows ongoing commitment to coordinated, evidence-based action. Through shared knowledge and solidarity, we can end this global health emergency together.